Sorry about that. My computer died. But it's back. All right. So where we left off. So basically there's going to be an inspector general and an oversight board. So it's not going to be the president who's in charge of what's happening to this money. That was one of the big complaints that the Democrats had. So they created a new position, the inspector general, who basically decides, who's getting this money and how much money. So at the White House on Tuesday, even as the public health crisis deepened, Donald Trump expressed his eagerness to nudge many people back to work in the coming weeks and held out a prospect based more on hope than science that the country would be returning to normal in less than a month. So scientists, it seems like, think that is incredibly optimistic and unlikely. Honey, that's way too loud. But the president is saying, we have to go back to work much sooner than people thought, Trump told the Fox News town hall. He said he'd like to have the country opened up and just raring to go by Easter, which is April 12th. But in a White House briefing later, Trump said our decision will be based on hard facts and data. Medical professionals say social distancing needs to be stepped up. Sidebar, if you are not following social distancing, please make sure that you're doing this. Read up on it. I've posted stuff. Go to the CDC website. It'll explain why it's so important. Should be stepped up, not relaxed, to slow the spread of infections. At the White House briefing, the public health authorities said it was particularly important for people in hard-hit New York City metropolitan area to quarantine themselves for 14 days, and for those who have recently left the city, do the same. Dr. Anthony Fauci, the government's, I really hope I pronounced that right. I've been reading his name all week, but I haven't actually heard it, I don't think. The government's top infectious disease expert said, pointing at the briefing, no one is going to want to tone down anything when you see what's going on in a place like New York City. For most people, the new coronavirus causes mild or moderate symptoms such as fever and cough that clear up in 2 to 3 weeks. For some, especially older adults living with existing health problems, it can cause more severe illness, including pneumonia and death. The vast majority of people recover. The virus has caused a global pandemic that has sickened more than 425,000 people and killed about 19,000 people worldwide. In the United States, more than 55,000 people have been sickened and more than 800 have died. So that's the end of that article. If you want to take a look at it, it is posted on the blog. I would encourage folks, if you look on the CDC website and the Massachusetts government, I think it's just if you go to mass.gov, let me confirm that right here while it's still on. If you go to mass.gov, there's a link, literally the very first link. It says coronavirus update, and there is an update from today. Every single day, the state posts how many cases there are in every county, and you can kind of track how many more we're getting each day. So I can see a link. It says today's cases, quarantine, and monitoring, and you can scroll down and look at that and see exactly how many cases. So right now we are at 1,159 cases in Massachusetts. That was as of yesterday. 1,159, sure. So yeah, so feel free to scroll through that. Keep an eye on whether or not that bill officially gets passed, gets signed into law, so that we can start helping our healthcare workers. Ms. Coburn and the rest of the staff did a video chat today. So if you, I think she's probably going to post on Facebook. We tried to do a little chant. It kind of sounded ridiculous, so you might want to watch it just so you can kind of make fun of us. But otherwise, I hope you're all doing well. I hope you're taking care of your families and staying away from everybody. And I will check in tomorrow. See ya.